Hello and welcome to my revision guide on safeguarding legislation in health and social care. My name is Angela Kemp and I'm studying Level 3 Health and Social Care on the Nursing and Midwifery pathway. This video will be useful to students both on the nursing pathway and those on the education pathway, as both classes must take a 60 credit exam on the unit. Everybody that works alongside service users is responsible for maintaining their well-being and protecting them from potential neglect, harm and abuse. Legislation makes safeguarding a legal responsibility to ensure the safety of those in the care of any health and social care setting. For your exam, you must learn the following legislation. This may seem daunting, so it may be useful for you to come up with a fun acronym to remember them. In this video, I will explain what each legislation does and how this safeguards individuals. The Health and Social Care Act 2008 established the CQC in order to inspect all the health and social care settings, meaning that all settings are now held to a rigorous standard and safeguarding concerns can be identified. The Care Act 2015 puts a duty on the local authority to investigate all reports of abuse so that intervention can take place if necessary to prevent further abuse. Local authorities must also use a multi-agency approach to review cases where an individual dies of abuse to make changes in practice so it doesn't happen again. The Human Rights Act gives everyone in the UK the same basic rights, such as the right to live, the right to freedom from degrading treatment, and the right to privacy. This helps protect people from illegal treatment that could be harmful to their emotional and physical well-being by giving all individuals the same basic legal rights and protection. Similarly, the Equality Act 2010 protects people with protected characteristics from discrimination, bullying, or harassment. These protected characteristics include things such as gender, race, disability, or age. This safeguards individuals as it prevents and criminalises victimisation or targeting individuals based on their characteristics, therefore minimising the potential risk of neglect, harm, or abuse. The Data Protection Act requires that all confidential information is kept safely and securely so that it cannot be accessed by anyone that it shouldn't be. Confidential information should also be kept no longer than is needed by the services or the service user. This ensures that no one can access this information and use it to blackmail or purposefully use an individual's vulnerabilities, such as their disability, against them in order to abuse them. The Public Interest Disclosure Act aims to protect individuals who report suspected or disclosed abuse. People who report malpractice or abuse are called whistleblowers. The legislation also provides a clear legal framework to enable individuals to whistleblow effectively. This safeguards individuals as people are more likely to report abuse if they know they are legally protected by legislation. It also helps individuals to whistleblow effectively, therefore increasing the chance abuse will be prevented. The Mental Capacity Act aims to protect and empower individuals who lack mental capacity. These are individuals who are unable to make decisions for themselves for any reason, such as disability or a mental health condition. For example, it cannot be assumed that an individual lacks mental capacity, and just because an individual makes an unwise decision does not mean that they lack capacity. All decisions made on an individual's behalf must be done in their best interests, and the individual must always be involved in decision-making. Additionally, the least restrictive option must always be considered and used where possible so that individuals' rights and freedoms are not severely impacted. This safeguards individuals as it ensures that they receive the best quality of care and do not have decisions made for them that could harm them or put them in an abusive situation. It also helps protect against physical abuse by minimising the use of restrictive restraints against an individual. The Safeguarding Vulnerable Groups Act introduced the DBS, a legal document which lists an individual's previous criminal convictions. This helps to prevent dangerous people and abusers from gaining access to vulnerable people through their work, as employers can choose not to employ them if they are deemed unsafe. Safeguarding Adults 2005 provides a legal framework for good practice that can be used by health and social care practitioners in all settings. For example, it states that there should be a clear zero-tolerance policy of abuse and that all settings should give their staff safeguarding training. This helps to discourage workplace secrecy where abuse isn't reported by practitioners and instead promote whistleblowing, as well as to train all staff on how to be vigilant and spot signs of abuse so that it can be reported promptly. The Children's Act established a Children's Commissioner to promote the well-being and interests of children. This helps to prevent harm and abuse by actively ensuring that the needs of children are recognised, therefore minimising the risk of neglect in all settings. It also puts a duty on local authorities to adopt a multi-agency approach across all agencies and organisations that work with children in order to minimise the risk of abuse, as it enables organisations to communicate identify abuse, and report suspected abuse more clearly. Working together to safeguard children works hand in glove with the Children's Act 2004, as it simply provides guidance on how to implement a multi-agency approach that prevents abuse, which is promoted by the Children's Act. This means that organisations have a clear point of reference so that they are able to work with other organisations. Finally, the Rehabilitation of Offenders Act supports the rehabilitation of offenders by doing two things. Firstly, individuals with convictions or cautions may no longer have to state them if they become spent after a rehabilitation period. As well as this, custodial sentences under 48 months no longer have to be stated when applying for jobs, whereas it used to be mandatory to state them if it was over 30 months. This safeguards individuals as it gives offenders an opportunity to reintegrate back into society while preventing those with more serious convictions, such as sexual abuse or violence, from working with vulnerable individuals. And that's all you need to know for your exam. Thank you for watching. I hope it helped.